Good morning, everyone. So, I want to tell something about anxiety. So, what is anxiety? Anxiety is nothing but it's a fearfulness when we see some snake or lion or tiger. Suddenly, we will get sudden fearfulness, or before going to Viva or before going to meet someone, that is, we will feel that fearful, that apprehension, that is called as anxiety. So, for us, there is a reason for anxiety. So, without reason, if it comes as anxiety, fearfulness, then it is called as anxiety disorders. There are different types of anxiety disorders. So, one is generalized anxiety disorder, panic disorder, phobic disorders, obsessive compulsive disorders, post traumatic stress disorder. So these are all the types of anxiety disorder where common feature is, it is, you will see fearfulness as the common feature. So without anything, sudden rise of fearfulness will be seen in anxiety disorders, generalized anxiety disorder. Suddenly morning they will get up and they will have fearfulness throughout the day, continuously till they sleep. So that is called as anxiety disorders. They will have apprehension that something is going to happen in the life. Even though nothing is going to happen, and they will have that apprehension, fearfulness. So this is called as generalized anxiety. Patient will be floating in the anxiety. Floating in the anxiety. That is called as typical features of anxiety. There is another disorder called as panic disorder, where there is sudden rise of fearfulness. Sudden rise of fearfulness. That is, patient will have suddenly feel fearful, which increases, it shoots up to the level that patient feels that something is going to happen. That is like heart attack, or I am going to get something, I am going to become mad. So like this they will get anxiety. So it will reach maximum peak within 5 minutes, 5 to 10 minutes, and within 5 to 10 minutes, that is, whole episode is over. And in a day, about 3-4 times they will have this type of anxiety. This is called as a panic disorder. And there is another category called phobic disorder. Phobias usually seen in when there is a situation. Suppose when you see an accident, and following any, that is, seeing any vehicle or any accident, or if you heard any accident, then definitely patient will feel more anxious. They will become, whenever anything remembers about this thing, they will become anxious. Situation, they will become anxious. Suppose somebody is having social phobia. That is where there is a social situation. That is, suppose he has to give a speech in the public, or he has to face somebody in the group. So then he will have the anxiety. That is called social anxiety disorder or social phobia. And some people will have phobias for particular animals. That is called zoophobia. And particular objects like blood. That is called erythrophobia. Some people will have fear for height. That is called as acrophobia. Some people will have fear for closed space, that is called claustrophobia. Some people will have fearfulness for open space, that is called agoraphobia. There are list of phobias. So that is commonly what they will have is anxiety is the common feature, and usually that is sudden rise of this thing will not be seen in this year. Whenever that situation is there, they will have the problem. This is called phobias. Then comes post-traumatic stress disorder. Post-traumatic stress disorder, patient usually experiences some accident, or some people undergone that is, girl undergone rape, or seen accident, or seen fire accident, or seen some train accident. So where there is that is severe form of trauma. If anybody is there, they will have that trauma. So that is following this incident. After 6 months of this incident, patient can develop similar symptoms when he experienced during the trauma. So that is called as post-traumatic stress disorder. That is many people experience in America. Many people experience following that collapse of two towers following terrorist attack in America. Many people have developed post-traumatic stress disorder. Whenever there is a sound, whenever somebody remembers about that this thing, they used to feel that anxiety. And anxiety to the level of already it has happened 6 months back or 1 year back, and they will have the symptoms present, and presently they will think it is happening in front of me. So that much of anxiety will be there. That is called post-traumatic stress disorder. Another in the group of this thing, another disorder is called as obsessive compulsive disorder. So these people will have repeated thoughts, repeated doubts, repeated images, repeated images. So it can be thoughts, doubts, images, incidents, impulses. So following obsession, it is followed by compulsion. That is usually whenever they feel obsessions of contamination, they feel washing. Or whenever they feel doubt, obsession of doubt, they start checking or counting. So these are all the counteracting mechanisms. So this is called as obsessive compulsive disorder. So in all these common anxiety disorders, common thing is anxiety. Anxiety is a common thing. And usually what happens, treatment is same. That is, benzodiazepines are the common treatment for all these things, all these disorders. And SSRIs, SNRIs, tricyclic antidepressants, and all these things can be given. So these things are given only for short period, that is 6 weeks to 8 weeks, or maximum 3 months or 4 months. Even up to 6 months we can give treatment. So and remaining things, that is, patient has to modify his lifestyle. Then only patient becomes completely cured of this anxiety. Otherwise, what happens? Every day he will start having the problems, and he will become dependent on tablets or benzodiazepines or tablets. Without tablets, patient's symptoms will not get cured. So he needs continuous medications. So that if that should not happen means, that is what they have to do is, they have to do relaxation exercises. Then relaxation exercises are Jacobson's progressive muscular relaxation exercise, then pranayam, anulom vilom. So these are all the very effective treatment of anxiety disorders. So for the any generalized or any anxiety disorders, for the initial period we have to treat with the medication, and following that, that is they have to maintain with this meditation, then relaxation therapies, then anulom vilom. So the daily morning when they go for walking or this thing, they have to do continuously all these anulom vilom about 15 to 20 minutes. Then only their anxiety will be permanently cured off. Otherwise, they have to take continuous treatment. They will become dependent on medications. That should not happen. So if that should not happen, they have to do their yoga, pranayam, and relaxation exercises, all these things regularly. And you have to, for any situation, you should not get anxious. So these are all the things. Always you should keep calm and you should smile on. So when you smile, that is there is a release of chemicals in the body. So this is anandamides. Anandamides are released in the body, and these will be helpful to relieve your anxiety. So whenever we see a snake, that is, we don't take any tablets for fearfulness. Naturally, it will come down. So that is, in our body only there are anandamides, chemicals which are equal to tablets. So that's why always you should keep calm your mind and always smile. Then only your mental condition and you won't get any disorders. This is my suggestion. Thank you.